It's great to have you back on board, my brothers and sisters. For those new to the channel, consider this your official welcome to the family. When your car breaks down, you ask everything. What's wrong? How long? How much? Do we ask as much about our bodies? We trust experts, yet results can feel like code. Your body has warning lights too. Pain, fatigue, fever. Knowledge is power in healthcare. Understand tests to talk better, decide wisely, and feel calmer. Today, a fast guide to medical diagnostics. Medical tests are a detective toolkit for your health, solving mysteries, preventing problems, and guiding care. Blood tests act like a liquid biopsy of your body. A small vial can carry clues from many organs, collected safely, quick, and with low discomfort. Common panels include the CBC, which counts blood cells for signs of anemia, infection, or inflammation. HbA1c reflects average blood sugar over 3 months, vital for diagnosing and tracking diabetes control. Basic and comprehensive metabolic panels check kidneys and electrolytes, and in the CMP, your liver. A lipid panel reports LDL, HDL, and triglycerides to estimate heart risk. Thyroid tests, TSH, T3, and T4, help explain metabolism, energy, and mood changes. In emergencies, cardiac troponin rises when heart muscle is injured, numbers that guide rapid, life-saving decisions. Imaging lets clinicians look inside. X-rays show bones and quick snapshots. CT offers cross-sections. MRI gives detailed soft tissue views. Ultrasound shows real-time motion without radiation. PET maps metabolism, lighting up active cells so structure and function can be read together. Imaging safety tips. Tell your doctor about contrast allergies and kidney disease. CT uses radiation, MRI uses magnets without radiation. From blood to imaging, these tests turn symptoms into a plan. Clearer answers, less guesswork, and care that fits you. What your body eliminates can be as informative as what's inside. Urine and stool tests reveal digestive and urinary health. Urinalysis examines appearance chemistry, microscopic elements, screening for UTIs, kidney disease, diabetes, liver problems. Collection is simple: a sterile midstream sample. Stool tests uncover hidden issues. Fecal occult blood detects invisible bleeding that may signal colon cancer. Cultures identify bacterial infections. Ova and parasites find parasitic causes. Most are done at home with a special kit. Clear instructions labeled containers. Quick lab processing turn everyday waste into actionable answers. Saliva tests are simple and non-invasive, used for cortisol day curves, some hormones, drug screens, and oral infections. Great for screening and home collection, though some analytes are less reliable than blood. Mucus or sputum samples check color and cells. Labs culture bacteria and run PCR to spot specific germs. Useful in pneumonia, chronic cough, asthma flares, and cystic fibrosis care. Semen analysis evaluates fertility, count, motility, morphology, and can screen for infection. Collection is simple with 2 to 5 days of abstinence. Privacy is respected. From simple samples to clear answers. When doctors need cellular detail, they use biopsies and cytology, zooming from organ to cell to answers. Biopsies remove tiny tissue samples for the microscope. Depending on location, it may be a fine needle sample, a small surgical piece, or tissue collected via endoscope. These tests confirm or rule out cancer, assess tumor grade, and pinpoint inflammation or infection. Cytology studies shed cells. The pap smear is the best known example. A gentle brush collects cervical cells placed into a vial, then examined for early changes, often long before symptoms. Simple, quick, and life-saving. Cellular detectives at work. Endoscopy uses flexible cameras. They let doctors look directly inside hollow organs, often diagnosing and treating in a single session. Colonoscopy surveys the colon for polyps and cancer. Upper endoscopy, or EGD, views the esophagus, stomach, and duodenum. Bronchoscopy explores the airways. Capsule endoscopy uses a swallowable pill-sized camera to image the small intestine if something looks suspicious on the screen. Tiny tools can pass through the scope to remove polyps. They can stop bleeding, widen narrowings, and take targeted biopsies. Those samples link the visual finding to cellular answers. Preparation and sedation vary by procedure, but most are outpatient with quick recovery. Risks are low and discussed in advance. Endoscopy turns images into action, seeing problems, sampling them, and often fixing them, all from the inside. Your body runs on electricity. These tests capture its signals to pinpoint problems, non-invasively, step by step. Step 1. ECG. Electrodes on chest, arms, legs record heart rhythms. It flags heart attacks, arrhythmias, conduction blocks, thickened muscle. Quick. Results in minutes. Holter and patch monitors record ECG for days. Great for catching intermittent palpitations or fainting spells. Step 2. EEG. Scalp electrodes map brain waves at rest with stimuli. Helps diagnose epilepsy, sleep disorders, encephalopathy, effects of head injury. You sit or lie still. Gel or caps improve contact. Step 3. EMG and nerve conduction studies. Surface electrodes deliver tiny pulses. Fine needles in muscles record activity. Useful for carpal tunnel neuropathy, radiculopathy, myopathies. Expect brief tingles and mild soreness. What you see. Clear waveforms. ECG, EEG, EMG, NCS. What clinicians see. Patterns, latencies, amplitudes that separate heart causes, brain causes, nerve causes, muscle causes. Safety and prep. Remove metal, keep skin clean, list medications. Most tests are outpatient, low risk, and guide targeted treatment, not guesses. In physical function tests, we measure how well your body performs in motion, not just at rest, so treatments target what you actually need. Pulmonary function tests check lung capacity, airflow, gas exchange. You'll breathe into a mouthpiece. Short, fast blows, long, steady blows, while graphs update in real time. Results help detect asthma, COPD, fibrosis, and track response to inhalers. The 6-minute walk test estimates endurance and oxygen needs. Useful in lung and heart disease follow-up. Prep is simple. Avoid heavy meals, follow inhaler instructions, and seal lips firmly around the mouthpiece for accurate readings. A cardiac stress test monitors your heart during exercise, walking on a treadmill or cycling, while ECG and blood pressure are tracked. It helps spot coronary artery disease arrhythmias that show up with exertion and your functional capacity. You'll start easy and ramp up gradually with a team beside you. Wear comfortable clothes, bring sneakers, and skip caffeine if advised. What you see, clear graphs and numbers. What clinicians see, thresholds, recovery times, and patterns that turn symptoms into a plan, so you can breathe easier, move stronger, and live smarter. Reference ranges vary: age, sex, population. Results outside normal don't always mean disease. Trends over time often matter most. No test is perfect. Sensitivity finds those with disease. Specificity rules out those without. Both guide how to trust a result. A false positive suggests disease when none exists. A false negative misses an existing condition. Clinical context is essential. Look beyond a single number. Compare to your baseline, note direction and rate of change. Match findings to symptoms. What does this measure? What's the reference range for me? How does this fit my history? Do we repeat? Confirm? Act now. Context plus trends equals clarity. Pre-test probability matters. Test results confirm a clinical suspicion, not replace it. Turning data into decisions you can trust. Imagine test results that are smarter, gentler, and always with you. Liquid biopsies read fragments of tumor DNA in a simple blood draw, catching cancer earlier and tracking treatment in real time. AI scans oceans of data, surfacing patterns humans might miss. Explainable models show why a result matters, not just what it is. Wearables and home sensors shift testing from snapshots to a living timeline. Heart rhythms, glucose, sleep, oxygen, stress, building your personalized baseline hour by hour. Genomic panels map risk, proteomic panels map drug response, guiding truly tailored care. And nanoscale sensors inside the body promise continuous monitoring from the inside out. Privacy and equity come first. Secure, interoperable records, patient-owned data, algorithms audited for bias. Edge computing protects information. Federated learning trains across devices to protect privacy, improving the system for everyone. The goal isn't more numbers, it's clearer answers. Less invasive, more precise, continuous when needed. Always interpreted in context and trends, alongside your story. The future of testing turns data into decisions you can trust, even faster, earlier, more personally than ever before. Medical tests are powerful tools that revolutionize care, guiding treatment and saving lives. Remember, discuss results with your clinician. Context is everything. Regular screening finds problems early. Your active participation matters. And this is just the beginning. Join our 7-part deep dive series. Blood tests decoded. Read your lab report and what the numbers really mean. Medical imaging revealed. MRI, CT, X-ray. When to use which and how to prepare. Urine and stool analysis. The hidden clues in simple at-home tests. Biopsy and cytology. How tissue is sampled and your pathology report explained. Endoscopy Insider's Guide. See how doctors diagnose and treat from the inside. Electrical tests illuminated. ECG, EEG, EMG made clear, beyond the squiggly lines. Functional testing explained. Stress tests and lung function and what they show. Don't miss it. Subscribe, enable notifications, and tell us which topic you want first. Your health journey deserves understanding. We'll guide you through every test, every result, every question.